It's quite a process that women have to go through. So I always sort of tell people to imagine that their ovaries look like a bunch of grapes, and each grape is a follicle, and inside each follicle is an egg. And naturally, once a month, your brain sends a little hormone signal to one of those follicles. That follicle gets bigger and bigger and bigger and releases the egg. And that's the egg that could potentially get fertilized that month by a sperm. But most women have more than one follicle. Most women will have a dozen or so follicles in their ovaries, depending on their age. And IVF is a lot to go through if you're only going to get one egg at the end of the process. So the first stage of IVF really is giving you hormone injections to stimulate your ovaries so that all the follicles get big all at the same time. And then we can potentially get an egg from each follicle. And the way that we retrieve those eggs is done under sedation. So it's not a full-on general anaesthetic, but the anaesthetist will pop a little drip in the back of your hand and give you some medicine to relax you and to kind of numb the feeling. And then with an internal scan, it's got a needle attached to the scan probe. We put the needle through the vagina into the follicles of the ovaries, suck out all the fluid that the follicles contain, give that fluid straight away to the embryologists. They look at it under the microscope and count and collect the eggs. That usually takes about 10 and 15 minutes. And then that afternoon, the embryologist will fertilise the eggs with the sperm, and then they put the fertilised eggs in an incubator and let them grow for 5 days. And at the end of that 5 days, they'll look at the embryos under the microscope. They'll pick the best looking one. That's the one that they would transfer back into your womb. But if there's any surplus embryos that are good quality, then we would freeze those for you so that they're available for future use. The embryo transfer is a bit like having a smear test, so similar sort of procedure, similar equipment, similar sort of sensations. We just pass a very fine catheter through the neck of the womb, and when that's in position, and you'll see it on this scan, we just inject the embryo, and then you go home and you have a very long 2-week wait, during which time you'll have stopped all the injections, but you will need some progesterone pessaries. They're just to kind of nourish the lining of the womb and encourage implantation and support the early pregnancy. And then at the end of the 2 weeks, you will hopefully have a positive pregnancy test.